Here now with some practical advice is our medical specialist, Dr. Karl Kabasele. So, Dr. Karl, why are we seeing so many cases of the flu this year?
Well, you know, the influenza virus, which causes the illness, loves this time of year. It likes cold, dry conditions, and it really thrives in those conditions. And when it's winter, we all tend to get inside, and it's easier for us to pass germs back and forth. But there's something about the strains that are circulating that may be particularly aggressive this year. It can be difficult to know until we look back at the end of the season to figure out what happened.
Now, we all know that we're supposed to stay home when we get the flu, and too many of us don't. But what are some of the signs that, in fact, we should go and see a doctor?
Right, exactly. We don't want to clog up the emergency rooms, but of course, if something serious happens, it is important to seek immediate medical attention. Now, the #1 complication is pneumonia, actually. And pneumonia, we'll just take a look at some of the symptoms here. Pneumonia, in terms of what to look for, difficulty breathing, obviously, and high fever are signs that you're going to need prompt medical attention. Now, the other complication is diarrhea, vomiting, and nausea, and that happens sometimes. It's, you know, influenza is a respiratory disease, but occasionally you get gastrointestinal symptoms. In that case, you may become dehydrated, and you're looking for things like dizziness, drowsiness, and extreme fatigue, and especially to the point where it's difficult to wake the person up. That's when you need to call for help.
And can we still get a flu shot? Is it too late?
Well, you know, it's never too late. Even if you've already had the flu, by the way, you can still benefit because the flu shot contains 3 different strains of the virus. And the other thing is, for those people who are a little worried about needles or not comfortable with them, this year, more than ever, there is available a vaccine that you can sniff up the nose, basically. It's a nasal spray that can give you very similar protection to the shot.
Good to know. Dr. Karl, thanks very much.
Thank you.